Okay, so this is the planning stage. We're looking at the patient's skeleton, the femur, and how the implant will sit. It's very important to match anatomy exactly. This is the tibia component that we measure in size as well. The width is critical, and this patient fits that size just right. We look at the osteophytes, the bone spurs. The tibia size is very important. This last view looks at the alignment. The cuts on the tibia and the femur determine the alignment, whether it's going to be zero or physiologic varus to match the patient's anatomy.